everyone. I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye care. Our question today is, Dr. Mattis, I recently developed a painful lump on my eyelid. I'm not sure if this is a Stye or a Chalazion. Could you please explain the difference between a Stye and a Chalazion? First of all, I see that you are researching your symptoms, but be careful. Use the internet for information only and try not to diagnose yourself. Now, sometimes it can be difficult to tell the difference between a Stye and a Chalazion. Now, a Stye is usually very painful. It often appears at the eyelid's margin and is usually caused by an infected eyelash root. It often swells, sometimes affecting the entire eyelid. A chalazion is not usually painful. It is a lump that usually develops further back on the eyelid than the Stye, and it is caused by a clogged oil gland. Rarely does it make the entire eyelid swell. Now, a Stye is really a bacterial infection, and a chalazion is caused by a blocked oil gland. Both conditions may cause redness and swelling, though Styes usually hurt more. Now, what are the symptoms of Styes and Chalazion? Now, the symptoms of Styes can include a very painful red bump along the edge of the eyelid at the base of the eyelashes, and it may make the entire eyelid swell. Usually, a small pus spot at the center of the bump exists. Sometimes it feels like something is in your eye. There may be a scratchy feeling in the eye. You may be sensitive to light, and there may be crustiness along the eyelid margin, and also some tearing in that eye. Now, what is the difference with a chalazion? There's also a bump on the eyelid, and it sometimes becomes red and swollen. Occasionally, it can be tender. It rarely swells up the entire eyelid. You may get blurry vision if the chalazion is large enough to press on the eyeball. Now, how do we treat a Stye or a chalazion? Both we can use warm compresses. That means soak a clean washcloth in hot water and hold it on your eyelid for about 10 to 15 minutes at a time, 3 to 5 times a day. You can keep the cloth warm by soaking it in hot water often. Now, for a chalazion, this warm compress helps the clogged oil gland to open and drain. Antibiotics. We use antibiotics both as a tablet or for topical use. So antibiotics may be prescribed for an infected Stye. And certainly, if the swelling is very large, swelling the entire eyelid, we may also prescribe oral antibiotics. We may also have to do surgery to drain the area. If your Stye or chalazion does not go away, it may need to be drained. This surgery is usually done in the doctor's office under local anesthesia. If your Stye or chalazion keeps coming back time after time, your ophthalmologist may biopsy it. This is where a tiny piece of the tissue is removed and studied with a microscope. This will help us to check to see if there's a more serious eye problem that this swelling is causing. Now, please remember, do not squeeze or try to pop a Stye or chalazion. Doing so could spread the infection into your eyelid and cause a more serious eye infection. Do not wear eye makeup or contact lenses while you have a Stye or chalazion. These conditions usually resolve without any serious visual problems. So, thank you for watching and see you next month for our next insightful session. And remember, if you have questions, just drop them in the comments section below.